Shocking ear infection revealed. Watch if you are having earwax buildup or it's an ear infection. Welcome once again to our channel, your ultimate destination for unlocking the secrets to a healthier, happier life. At VitalityVortex, we believe that true wellness starts at home. And that's why we're dedicated to providing you with valuable information about your health and well-being. We will share with you valuable information about home remedies and holistic approaches to health. Whether you're looking for natural remedies for common ailments or seeking ways to enhance your overall wellness, we've got you covered. In today's video, we'll be diving deep into a topic that affects many ear health. We will tackle the uncomfortable and concerning symptoms often associated with ear problems. From the annoyance of a clogged ear to the discomfort of ear pain, these symptoms may signal underlying issues like ear infections that demand attention. Experiencing symptoms like ear fullness, ear pain, or signs of infection can be worrying, but understanding the potential causes can help alleviate concerns. We'll explore 5 common culprits behind these symptoms, such as earwax buildup, Eustachian Tube Dysfunction, otitis media, otitis externa, or swimmer's ear, and sinusitis. First, let's talk about earwax buildup. Excessive earwax accumulation can cause a sensation of fullness or blockage in the ear canal, leading to discomfort or reduced hearing. Earwax buildup, also known as cerumen impaction, occurs when there is an excessive accumulation of earwax within the ear canal. It is a natural substance produced by the glands in the ear canal. Its primary function is to lubricate and protect the ear canal by trapping dust, dirt, and other foreign particles, as well as inhibiting the growth of bacteria. However, in some cases, the production of earwax can exceed the rate at which it naturally moves out of the ear canal, leading to buildup and blockage. Managing earwax buildup or impacted cerumen at home can be done safely and effectively with a few simple steps. However, it's important to exercise caution and avoid inserting any objects into the ear canal, as this can push the wax deeper or cause injury. Here are some methods for managing earwax buildup at home. Softening the wax. Use over-the-counter ear drops specifically designed to soften earwax. These drops typically contain mineral oil, hydrogen peroxide, or other gentle ingredients. Warm the eardrops to body temperature by holding the bottle in your hand for a few minutes before administering them. Lie on your side with the affected ear facing upward and instill the recommended number of drops into the ear canal. Gently massage the area around the ear to help the drops penetrate. Allow the drops to remain in the ear for several minutes to soften the wax. Irrigation. After softening the wax with eardrops, you can perform irrigation to help remove the loosened wax. Use a bulb syringe or ear irrigation kit filled with lukewarm water. Tilt your head to the side and gently squirt the water into the ear canal, aiming slightly upward. Allow the water to drain out of the ear, along with the softened wax and debris. You may need to repeat this process several times until the ear feels clear. Manual removal. If the wax remains impacted despite softening and irrigation, you can attempt manual removal using a washcloth or tissue. Gently wipe the outer portion of the ear canal with a damp washcloth or tissue, avoiding insertion into the ear canal. Do not attempt to use cotton swabs or other objects to remove the wax, as this can push it deeper into the ear or cause injury to the ear canal or eardrum. Seek medical advice if needed. If you are unable to manage the earwax buildup at home, or if you experience severe pain, hearing loss, or signs of infection, such as drainage or foul odor from the ear, it's important to seek medical advice from a healthcare professional. A doctor or ear, nose, and throat ENT specialist can safely remove impacted earwax using specialized tools and techniques, if necessary. Now let's talk about Eustachian Tube Dysfunction. Dysfunction of the Eustachian tube, which helps regulate pressure in the middle ear, can result in sensations of fullness, ear pressure, or difficulty equalizing pressure, common during air travel or changes in altitude. The Eustachian tube serves as a crucial pathway that connects the middle ear to the back of the nose. Its primary function is to maintain equal pressure between the middle ear and the external environment, ensuring optimal hearing and balance. This tube is typically flexible, allowing it to open or pop easily, facilitating the release of pressure and preventing sensations of ear blockage or muffled hearing. In scenarios where pressure changes occur, such as during activities like ascending or descending in altitude, for example, flying mountain climbing, the eardrum may respond by bulging outward or inward due to the disparities in pressure between the middle ear and the external environment. Popping the ears helps to open the Eustachian tube, allowing pressure to equalize by either releasing excess pressure from the middle ear into the back of the nose, or allowing outside air to enter the ear to balance the pressure. However, in cases of ear infection, the Eustachian tube's function may be impaired by additional factors, such as fluid accumulation and inflammation. The inflammation can lead to swelling of the Eustachian tube lining, making it challenging for the tube to open through typical popping techniques. Consequently, individuals may experience persistent sensations of ear blockage, hearing loss, or discomfort. With time and appropriate medical intervention, such as anti-inflammatory medications or decongestants, the inflammation and swelling in the Eustachian tube lining may resolve. This allows the Eustachian tube to regain its flexibility and ability to open naturally through popping, facilitating the release of fluid and pressure from the middle ear. However, in cases where swelling persists despite conservative treatment, surgical placement of an ear tube may be necessary to provide an alternate route for drainage, thereby relieving symptoms and restoring normal ear function. How about otitis media? This refers to middle ear infection, often accompanied by ear pain, fluid buildup, and sometimes fever. Otitis media can occur due to viral or bacterial infections and may require medical treatment. There are two types of otitis media, which includes acute otitis media and otitis media with effusion. Acute otitis media. This type of otitis media typically occurs as a result of a bacterial or viral infection. Symptoms of acute otitis media may include ear pain or discomfort, which can be severe, fluid drainage from the ear, hearing loss or muffled hearing, fever, irritability in infants and young children, and difficulty sleeping. Otitis media with effusion. This type of otitis media occurs when fluid accumulates in the middle ear without active infection or inflammation. This is more commonly seen after an episode of acute otitis media, but can also develop independently. It is often asymptomatic or may cause mild hearing loss or a sensation of fullness in the ear. Treatment for otitis media with effusion typically involves observation, as many cases resolve on their own without medical intervention. Next, let's talk about outer ear infection, or otitis externa, also known as swimmer's ear. This condition involves inflammation or infection of the outer ear canal, leading to pain, itching, swelling, and discharge. Common symptoms of otitis. Externa includes ear pain, which can range from mild discomfort to severe, sharp pain. Itching in the affected ear canal, which may precede the onset of pain. Swelling causes a feeling of fullness or blockage in the ear. Discharge from the ear, which may be clear, yellow, or bloody. The discharge may have an unpleasant odor. Outer ear canal may appear red and swollen. You may experience temporary hearing loss or muffled hearing in the affected ear due to inflammation. Tenderness to the outer ear to touch, especially around the entrance of the ear canal. How can you manage otitis externa at home? Let's open that medicine cabinet and see if there is something we can use to manage your symptoms before going to an expensive clinic visit. Let's start with managing our pain. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help alleviate ear pain and discomfort. Patients with otitis externa should avoid swimming or getting water in the affected ear until the infection has resolved. To prevent recurrence, individuals can take steps to keep the ears dry, such as wearing earplugs while swimming or using a hairdryer on a low setting to gently dry the ears after bathing. In some cases, the use of antibiotic or antifungal eardrops may be needed, but this needs advice from a healthcare provider. Now let's talk about sinusitis. Inflammation of the sinuses can sometimes cause referred pain to the ears, resulting in symptoms like ear fullness or discomfort. Sinusitis, also known as rhinosinusitis, is a condition characterized by inflammation of the paranasal sinuses, which are air-filled cavities located within the bones of the skull surrounding the nasal cavity. When the sinuses become inflamed and swollen, it can lead to a variety of symptoms, including nasal congestion, facial pain or pressure, headache, and postnasal drip. It can also cause ear fullness or ear pain or discomfort. You may also experience reduced hearing or a sense of muffled hearing, tinnitus or ringing in the ears. Some may experience dizziness or vertigo, but this is less common. Treatment of sinusitis-related ear symptoms. Addressing the underlying cause of sinus inflammation is crucial. Depending on the severity and duration of symptoms, treatment may involve use of nasal decongestants or corticosteroid nasal sprays to reduce nasal congestion and inflammation. The use of saline nasal irrigation to help clear nasal passages and sinuses. Warm compresses over the sinuses to alleviate facial pain or pressure. Also, you may use over-the-counter pain relievers, such as acetaminophen or ibuprofen, to help alleviate ear discomfort or pain associated with sinusitis. Performing certain maneuvers, such as swallowing or yawning, can help open the Eustachian tube and relieve ear pressure. Experiencing symptoms related to the ear, such as clogged ear fullness, ear pain, or signs of infection, may indicate various underlying issues ranging from earwax buildup to sinusitis. And please remember that the information provided for managing ear conditions, from earwax buildup to some of the common ear infections discussed above, are intended for general educational purposes only. These methods may not be suitable for everyone and should not replace professional medical advice, diagnosis, or treatment. Only a healthcare professional can provide appropriate evaluation and personalized treatment recommendations based on individual circumstances. Thank you for watching this video at VitalityVortex channel. We hope you found the information helpful in understanding various ear-related issues. Don't forget to like and subscribe to our channel for more informative content on health and wellness. And remember, your feedback is valuable to us. Share your thoughts and experiences in the comments section below. We look forward to hearing from you. Stay tuned for our next video, and until then, take care and stay healthy.